Hello, Fairfax County Public Schools. This is Dr. Brabrand, your superintendent, and welcome to the new year 2021. I am so delighted that you're here tonight with me at the Sprague Technology Center as we kick off the first town hall of the new year. And I must say, we are starting the new year with hope and help on the way. I shared with our Fairfax County Public Schools staff just yesterday the fantastic news that we are beginning the vaccination process for all FCPS employees as early as this Saturday, January 16th. I provided some additional information to them today, and I'll have final specific information for all of the staff on Wednesday. We're very excited about this vaccination process beginning for our 1B personnel, essential workers, and that all of our FCPS educators are being included in this effort. It's great news, and we're partnering very closely with the Fairfax County Health Department and with ANOVA to make this happen. I want to publicly thank them for their leadership and hard work to partner with us. I do want to just make a note that many of the folks in the vaccination process are already starting with our 1A workers. Some information has already gone out about that for 1A, and I did share with our FCPS staff earlier today, and I'm sharing it this evening, that we respectfully ask our staff members to refrain from linking on to those 1A links so that our other essential workers, our fire, EMS, and other personnel have an opportunity to get the vaccinations they need to perform their duties here in the Commonwealth of Virginia. I know there are a lot of questions about the vaccine, and as I shared, I'll have more information for all of our FCPS staff on Wednesday, but we really are excited about this development. I know many of you will be asking, all of us are asking, how will this impact return to school? As you know, I presented a detailed information and presentation to the school board last week, and I do believe that in-person instruction remains our goal, and it remains the best way to meet the needs of every one of our children by name and by need. We do have high COVID transmission rates in our community right now, and we shared that with the school board last week. And based on the concerns of our school board and staff and families, we did pause last week on the return to schools timeline. I will be bringing an update by February 2nd at our next monthly Return to Schools work session, and I may have an interim update as early as January 21st as we continue to work on return to schools here in Fairfax County Public Schools. Tonight, I'm very excited to have with me Marty Smith, our Chief Operating Officer for Fairfax County Public Schools. Great to have you here, Mr. Smith.
It's good to be here.
And as we start talking about our future return to school here in 2021, as we brought kids back in the fall, we know that we need to look at that CDC model for school reopening, and it's really based on 3 core CDC indicators that we've talked about before. First, community transmission in our community defined by the number of cases per 100,000. That's the first core indicator. The second core indicator is percent positivity. And the third core indicator is school mitigation strategies. Those strategies that schools can use that even if COVID is high out in our community, that COVID transmission can remain low in our schools. And Mr. Smith, I know you've been working on our safety teams who are going out to schools and really helping all of FCPS staff and students understand the importance of those school mitigation strategies. So I'd love for you to just walk us through, I know we have a few slides here tonight about the importance of the safety teams. First, why do we have them? And take us through a little bit of the work that you've been doing with our team.
Certainly, Dr. Brabrand, it's really good to be here tonight. You know, people have said, why are we doing safety teams? And it's really a way for us to inform our practice about our own mitigation strategies. Currently, we've had over 600 visits in schools with our safety team monitors, providing very good information for our principals and for our teachers about how well they're doing those strategies. I'll talk about those strategies in just a bit, but we're doing it because the CDC and the health department feel that this is the best way for us to mitigate the spread of the disease. They also feel that that K-12 schools can reopen for in-person when schools do these mitigation strategies well. It's important for us to do that. They also know that the correct and consistent implementation of mitigation strategies will enable us to provide that in-person instruction for students.
Great. Well, let's look a little bit further on beyond just why safety teams. If we can go to the next slide. I think the next slide talks about those mitigation measures that all of our staff and our students are really making sure when they're in school that they're paying deliberate attention to. Can you walk us through those just again for our viewing audience?
Sure. And what is it that we're exactly looking for? I've developed a bit of a mnemonic for myself because people ask that question quite a bit. So I start with the mask. It's that correct and consistent use of masks. Masks should cover your nose, they should cover your chin, and they should be looped over your ears correctly. So we'll be providing information on how well students and staff wear those masks. We're also going to provide some information on social distancing. We want to ensure that staff, just like we are tonight, are at least 6 feet apart and are social distancing to the best of our ability. It's important to think about how we're using our hands. Hand hygiene and that respiratory etiquette, sneezing into your elbow, making sure that students and staff are, when washing hands, are taking at least 20 seconds to do that. We're going to be focusing on our cleaning and disinfecting of our surfaces. And then lastly, we're going to be very focused on contact tracing and working very closely with the health department to make sure that we have procedures in place to follow up on students and which desks they've been sitting in, which staff members are in the buildings, which staff members are in which rooms. So in case there were an outbreak, we'd be able to have that information to follow up with the health department in a timely way.
And how long will safety teams be observing in the schools when they go in, Marty?
They're going to spend about 8 to 12 minutes in each location to provide that information for staff. They may go up to a teacher and ask a few questions. They may ask questions of a student, and they may even give some corrective action if they see that a mask isn't worn properly. A visit should last about 2 hours in total, and then at the end of that visit, the safety team monitors will meet with the principal or schedule a meeting soon after to go over the results of the visit.
Wow, and you know, they're going to be observing. What will they be observing when they go in? Where will they be observing within the school? Are they just in classrooms or are they all over the building?
No, we're going to be looking at dismissal, arrival procedures. We're going to be looking at care rooms where students might be. We'll be looking at lunchrooms. We'll be in open spaces. We'll be on playgrounds. We really want to get a strong sense of those mitigation strategies within schools all across the school environment so we can provide a full picture for our administrators.
And you know, Marty, we're all excited, or Mr. Smith, we're all excited about the vaccination news, but we also understand that for many of our employees, the history of vaccinations, folks want to understand the science behind these vaccinations. And we respect that in Fairfax County Public Schools, and we'll be working with our employees to provide additional forums for information about the vaccine. And it's so important because even with the vaccine news coming, we know that these safety teams and these school mitigation measures will remain critical to be able to successfully return students to in-person instruction.
Yeah, there really is no silver bullet.
There's no silver bullet, but we can all stop the spread. And we have a new Stop the Spread campaign through FCPS. Hope you'll go to our website and check it out, because it is a shared responsibility. It's the community and our school system who must work together in this year ahead so that we can get our students and families back to normal or as close to normal as possible. But COVID is still in our community, as we know, and we must continue to engage in all the different strategies and measures to contain COVID in our community and especially to contain it in our schools as we move forward this school year, for the remainder of this school year. Let's take some questions now for the Town Hall. Town Hall folks, please feel free to email or call in. We'll be glad to answer your questions. And I also just want to mention before, and we'll have another segment in a minute, that we have Ellen Mukai, who's principal of Brookfield Elementary, who was part of the pilots that we were doing before winter break. And you've had about 8 schools, and we'll be coming to you in just a bit, but you're here too to help answer any questions from a principal perspective that folks may have. So let's see if we have any callers. Let me see. We have a phone call. Caller, welcome to the 2021 Town Hall.
Yeah, Yes, hello. My name is Jennifer Dow. I'm both a physician and a mother of students here in Fairfax County. My question now is, I'd really like to focus on the emotional well-being of our children. And now with the vaccine rolling out, what guarantees do you have for the 2021 school year that the kids will be in school full-time 5 days a week? Also, when you look at the primary data in regards to both the Moderna and the Pfizer vaccine, the real difference in the placebo and the treatment group happens at day 10 after the first vaccination. So what would the timeline be for getting kids back into school given that data? Thank you.
No, thank you, caller, for both of those excellent questions. We are certainly working very closely with our medical team here at the Fairfax County Health Department and our health liaisons here in our school system to take that information and help us as we look at our return to school timeline. We have not had vaccinations as part of the criteria for return to school. This is outstanding news that the vaccination is here. We also need to understand that not all of our FCPS staff, though we will certainly encourage the selection of the vaccine, that not all of our staff will take it. We also need to remember right now that the vaccine, either for Pfizer or Moderna, is not available for our students. Pfizer, I think, is 16 and over, and Moderna is 18 and over. So we are still going to face a return to school where the ability for everyone to be vaccinated is not yet a reality. Your other question, I think I have forgotten it. Does anybody remember what that other question part was? The dates around return to school are something I'm working with staff. Thank you from the stage here. And we'll have an update around those dates on February 2nd. We're currently going back and working with all of our stakeholders. That's what the board made absolutely clear. Working with our families, working with our teachers, working with our principals to come back with a return to school timeline that we can all support. We will still have COVID in our community as we return to school. The vaccinations are great news, but it is not a magic wand. It's not a silver bullet. It is one more tool to help us make the environment in our schools as safe as it possibly can be for our students and staff.
And Dr. Brabrand, I think it's important as we're with the community tonight that any information that you share with us, we're going to take all of that information into consideration as we develop the return to school schedule and share that with the board in February.
Thank you. Thank you, Mr. Smith. Absolutely. Let's take another phone call. Caller, welcome to the 2021 Town Hall. Caller, welcome.
Hi, hello.
Hello, welcome to the Town Hall.
Yes, my name is Sue Zoldak, and actually you forgot to put me on hold when I dialed in. And the first thing I heard you guys talking about behind the scenes is that you're first going to talk about the return to school timeline with the teacher associations, by which I think you meant the unions. So can you clarify, when are decisions made actually with the staff and internally, and when are decisions actually run by unions, which are not actually Virginia unions first?
So thank you, caller, for that question. We work with a multitude of stakeholder groups. Our teacher associations are one of those groups. We also have a return to school task force that we meet with monthly that have parents, school board members, medical professionals, principals, all part of helping us guide our return to school decisions. We continue to engage with our community around these issues, these town halls. I think it's probably our 9th or 10th town hall because we do want to hear your feedback. We do want to have your perspective as we continue to go forward. Our teachers are a very important group, but there are many associations that we work with. Our folks in our support positions and our principals. And really, all of our families and staff are part of the solution as we return to school. Thank you, caller, for your question. Let's see if we have another phone call. Caller, welcome to the 2021 Town Hall.
Hi, my name is Elizabeth Stockety, and I was wondering if the SOLs were going to be impacted this year. Do you have any sense of that?
Yes, thank you, caller, for that question. You know, testing is still a very important part of our school life, and even with the pandemic, the issue of testing has come up from many perspectives. The reality is that accreditation this year will be waived as it was last year. Schools and school districts will not be judged on accreditation based on our SOL test. From all that we have right now, we do believe that the actual administration of the SOLs will continue as scheduled this year. And I do not believe that the change in administration that we're about to have at the national level will change the importance of wanting to administer these state assessments so that we can see where our children are in terms of their academic achievement as we prepare for the 21-22 school year. We'll have more information on SOLs in the coming weeks. We know that, frankly, as we get into second semester, the SOLs, our AP and IP exams, lots of our end-of-year assessments will be questions. But I am very, very hopeful that we will have the opportunity to have many of our students in school in person for these assessments. And we'll have much more information for you as we approach the spring on those issues. Let's take another phone call. Caller, welcome to the 2021 FCPS Town Hall. Welcome, caller.
Hello, this is Bernadette Murphy-Shield. I am a parent of FCPS students as well as a local pediatrician. I have specific questions regarding the mitigation factors and the safety studies that have been done. Obviously, only a small cohort of students have been in the schools. So what have the studies shown so far? And what is the timeline for further assessment if there is a pause in students entering the schools at this time? There seems to be a disconnect in between the recommendations from the health department as far as mitigation factors being part of the return to school, despite the community spread numbers, and the fact that the people that you named as some of the stakeholders are quite concerned, and namely the Teachers Association, quite concerned about these mitigation factors being met and not feeling that that is possible. Could you please speak to these issues? Thank you.
Absolutely. Thank you, caller, for that question. First of all, we did share with the school board and with our community last week information around FCPS's own data around COVID-19. We saw that for the majority of all of the students and staff in our schools over the period from when we began returning students and staff, which was late September, early October, through the beginning of December, about 4% resulted in COVID cases. When we looked at those COVID cases, of those cases, 90% were COVID that was already in the community that came into our schools. And less than 10% was actually COVID that was transmitted within the school. That speaks very well to the school mitigation strategies that we have. We fully admit that we only had a smaller number of students and staff. I think the total sample size was 12,000, which is the size of many school districts, and frankly in Virginia. But obviously we're over 180,000 student school district. But we know that as we continue to return students in person, following the data, sharing the data in a transparent fashion is critical to continuing to build confidence of all of our staff, our students, and our families as we return to school. One of the things that I think makes it hard in this whole discussion is we've all learned about the virus together. There were certain measures shared by the CDC back in the spring around percent positivity that did not reflect final CDC guidance. Early in the fall, the school board asked for thresholds of when we would pause if COVID were to go higher. We used 2 of the 3 CDC metrics focused on transmission in the community at that time. As the numbers went up, it did cause us to pause in late November, and early December. But to use all 3 of the CDC recommendations, which came to us in mid-September after we had opened school, to use all 3, we do need to look at school mitigation strategies. The challenge, I believe, honestly, has been incorporating all 3 in our decision-making model came at a time when COVID was rising across the country, across the region, across our state, and even here locally in Fairfax County. The first 2 are COVID itself. The third requires the human element, our own ability to follow these strategies. And I think building confidence in that is part of the successful strategy in returning to school. So thank you very much, and I'm sure we will be able to move forward here in 2021. We'll take another phone call, and caller, welcome to the 2021 Town Hall.
Hi, good evening. My name is Edward Emden. I have a question for you regarding the PAC program. FCPS's criteria that was established in the fall said that groups 1 and 2 would remain in person, essentially regardless of community transmission, which was consistent with state guidelines. Yet last week, FCPS elected to move these kids to virtual. So my questions are, what criteria led you to this decision for these groups in particular, which have the greatest challenges with virtual learning? And then secondly, without using this criteria that you had established, how will you know when it's time to send these kids back into the in-person classrooms?
Well, thank you, caller, for that question. You are correct that groups 1 and 2 did not have a threshold criteria that we had shared, even in the interim, for the amount of COVID transmission in the community. The school board last week, after hearing my presentation, did ask me to pause the return to school for groups 1 through 8. I've done that. And I shared later in the week with the school board at our regular scheduled meeting when I presented my budget for FY22 that I would have an update by February 2nd and perhaps an interim update in another week around returning to our return to school schedule. So we will have more information for you next week. We all want our students back in school, and we want to do it in a safe and responsible fashion, including our groups 1 and 2 and our students that we know are the most vulnerable and struggle the most in a virtual learning environment. This is a good opportunity, Ellen Mukai, our principal at Brookfield Elementary, to talk about having, as you did, many of those students back that you had in your school during the fall. And you also had a host of pilots bringing other students back. What were the challenges? What are the challenges as we return students to school, and what are things that we need to be thinking about and sharing with our community that are important for their students as we face very soon our students returning to school in person?
Oh my goodness. So we learned a whole lot from our pilot. We had 8 classrooms and we had 3 kindergarten classrooms. And with kindergarten, that's kind of a wild card. These kids have never been in school before and we don't know what skills they might come with. And so we were able to meet them at the door. They came with masks on already, so that collective responsibility with our families, folks knew what to do. They looked for the visual cues. Our teachers at elementary are really masterful at establishing visual cues for kids. And we teach procedures and routines all the time. And so when we thought about how are we going to ensure our youngest learners wear a mask and leave it on while they talk to one another. When we thought about how are we going to make sure that kids maintain that space so that they're safe and maintaining the 6 feet. Well, then we were able to put visual cues down on the floor or on the wall. And these are some of the ways that we were making sure our families and our kids knew what to do when they arrived at school and then again when they dismissed. One thing I want to make sure I say to our families is don't make assumptions that the way you did it last year is how you're going to do it this year. Your school is going to do an incredible job of giving you a lot of detail about how to come to school and what it will look like when you pick up your child at the end of the day. So pay attention because things will change some because we want to make sure kids are safe.
One of the things, Ellen, that we've heard a lot about when we talk about the school mitigation strategies that Mr. Smith just talked about, including masks and young people and some of our special needs, how to build that culture of mask wearing. There was some concern that that would be a real challenge for some of our youngest learners, particularly at elementary school. Talk a little bit about, I know you mentioned visual cues, but how did it go? Was it a little hard at first and it took a day, a week, a month? Mm-hmm. I know you had again, you had your groups 1 through 4 in for several months, and your pilots ran for several weeks.
That's right. I think everything takes some time to get it into our routine. We knew that kindergartners, for example, might have the greatest challenge. We anticipated that. I don't know that that was a true statement. That was an assumption that we had. One thing our teachers did is they actually built in some routines. At the end of the day, they had lanyards. And so the kids' masks were attached so that if they took it down for lunch or if they needed to take it down to get a drink of water, it didn't fall on the floor. It didn't. So I think trusting our classroom teachers to do their job will really enable us to be successful.
Ellen, you mentioned lunch. That's a topic as we're
Yes.
looking at returning to school in 2021 that many people are asking about at scale. How did lunch look at Brookfield, and how are you able to try to make sure that the mitigation strategies we already talked about, the mask wearing, the hand washing, obviously you have to put your mask down
Yes.
to eat lunch, social distancing. How did all that work, and how can parents prepare for things like the classroom routines and eating lunch with their friends?
So I would say lunch was probably the biggest change for kids ever. Instead of eating in the cafeteria hostesses would bring food down to the classroom door, and then kids would have it distributed to their desk. And so they would be eating in their classroom at their own desk where they're also learning all day long. Of course, the teacher would have them wash their hands prior to that. We have a very rigid hand washing routine and schedule. And so even washing hands for 20 seconds is a big adjustment. While we always had students wash hands or use hand sanitizer before lunch, 20 seconds is a long time to do that. And so that's one thing I would encourage families to do, is to really start thinking about how long are you washing hands at home, and then helping kids transfer that skill to the school setting.
I see, and this is a slide here that we have of your school at Brookfield with teachers leading instruction, and lunch was brought to them every day.
Yes. And so the cafeteria hostesses would bring the lunches to the classroom, and then we would distribute the lunches to the student desks, and that is where they would have their lunch. I think one of the biggest things is then kids had to learn to clear their desk. And so oftentimes in the cafeteria, there are people who come around and help wipe down the tables, and our kids really had to help us with some of those routines because they were a big shift, and we wanted to make sure that their desks were then again ready for learning in just a little while.
Wow. Well, thank you. Thank you for everything you're doing. What is something else that you would like to share from your experience with students in person from a parent perspective that parents should be thinking about as they're getting students prepared? We know we will have our students back this second semester in schools. Many have been out, as we know, for almost a year. You have been an elementary educator for many years in Fairfax County Public Schools, a real leader, and we're proud for you to now service as a principal. What should the parent, thinking as an educator, thinking academically but social-emotionally, what are the conversations that they should be having now if they've chosen to return their students to school in person and are waiting for that final timeline from us in the weeks ahead?
I think one of the most important things for parents to do is talk to their child. And all of us know our own children. And so, my advice would change based on what you know about your child. However, I think I would say to your child, school's a safe place. We had some students who came to school and they sat in their chair and they were super rigid and they were afraid to move because they do have fears around this catching COVID-19. And so they wanted to do everything just right. So I think that kids take their lead from us. And so it's really important that we have conversations with them to see how they're feeling and then guide it from there.
Marty, Mr. Smith, I'm going to turn to you. In our career together in FCPS, and we've both been we started our careers here over 25 years ago. You were an elementary school teacher and then an elementary principal. Are there things from your perspective that you'd want to share around the preparation for elementary students returning to school, things that you would want to share as an educator from a both teacher point of view and as a principal in a Fairfax County public school?
So as a principal, and as I think about my time as an assistant superintendent, and this is for our principals and for our staff, is to listen to our parents and listen to the concerns that they might have about the classroom. I've always found that when people come to you with a concern or a question, the more time you take to listen, the more time you can really get to the heart of what the issue is and take that information back and share it with your staff so that you can mitigate and make things better for the students while they're in the school, and also help the parent and walk that parent through what those changes might be when they do come back. And so listening is a really good way to work with the community, work with those parents that have concerns, and then share that information. And I think that from a principal's perspective as well, listening to your staff, listening to the concerns that they might have about their role within the school now that things have changed. I know that I've heard from teachers who are concerned about their role, concerned about what our expectations are, and so to be sure to be very clear about your expectations and be very clear about the work that we're doing to make sure that students and staff are safe.
You know, something that Ms. Mukai said, Ellen, that you said just a minute ago, in FCPS, we all want to do it right. And we want to do it the very best. The kids do, the teachers do, the principals do, the support staff, the bus drivers. We're a system. We are an elite school system. We want to be that shining light, that beacon of hope for kids across the country of this is the right way to do it. And I think sometimes that challenge is we have to be also willing to get out there and just do it. It's not about doing it perfectly. It's about doing it our very best. And as you already said, with each day, with each week, we build confidence in ourselves to be able to do it well and to do it safely for our students and staff. Let's take another call. Caller, welcome to the 2021 Town Hall.
Thank you. Good evening. I have 4 children attending FCPS. Would you please talk to how it is that private schools and less privileged communities in our region have been able to sustain operations for at least a portion of the student population, but the public schools have not been able to similarly service its students, particularly those that have challenges to accessing the virtual learning program? Thank you.
No, thank you very much, caller. I know that's a question that's come up, and you know, each community has really worked across the country to make their own decisions about return to school. Part of these decisions, honestly, again, is following the CDC guidance. It's also, at the end of the day, assessing the amount of risk that the community is willing to tolerate for its students, its staff, and its families. And that risk looks different in every community. We need to be honest with ourselves, and I am, that many of our communities around this country did open in person. Among the largest districts, however, 18 of the 20 largest districts opened virtually. The 2 that opened in person were required to do so by their governor. Many districts wanted to be sure that when returning kids to school in person, that it was done the right way and it was done in a safe fashion for students and staff. And private schools don't have the same need for public engagement and for stakeholder engagement that a public school system does. I certainly respect our private schools that have been able to return in person, and we will be returning. We did return in person this fall for some students, and we will be returning in person for students here this school year. So I'm looking forward to doing that and joining many of our private schools, and I appreciate that feedback this evening. Let's take another call. Caller, welcome to the 2021 Town Hall.
Hello, thank you for taking my call. My question is for our sophomores, juniors, and seniors. What is the plan to make up for students in AP classes, given that teachers in a multiple of AP classes are not keeping up with the subject matter that's on the exams? That's a 25% plus loss of instruction time between the loss of Monday instructions, shorter class lengths, shortening the school year, is making full subject matter instruction impossible for the teachers and students. So what are we going to do that the full course is taught and that our students are able to compete with national jurisdictions that are receiving the state-mandated 990 hours of instructions, which is being waived in Fairfax County?
Well, first of all, thank you, caller. That's a great question. I do want you to know we are meeting our state standards for instruction, both for our elementary and for our middle and high school students. We're working closely with the College Board. This is not just a FCPS issue. This is a national issue for the College Board around AP tests. We've also reached out to the International Baccalaureate folks around how to balance the demands of the curriculum. We are working very closely with professional development for AP and IB teachers to carefully balance the work that is in the AP and IB curriculum and making sure that we're maximizing the use of our synchronous time, our time in person virtually with the teacher. We're also going to have the opportunity, I believe, to return our students in person prior to the administration of these assessments and really have a chance for some additional review and interventions prior to the assessments. So we'll continue to work with our teachers around that, and I thank you very much for your question. Let's take another call. Caller, welcome to the 2021 FCPS Town Hall. Welcome.
Yes, this is Walter Cole, and my question is, I've had 4 students go through, 3 go through FCPS, and then 1's currently in. And my question is while in-person instruction is the ultimate goal, it's pretty clear that we're going to be virtual for a while longer. So is there a reason that we can't make it easier for parents to assist their students? Because what's happening, I've seen in my particular case, is our student is getting behind by a number of assignments during the week, and then we have to try to figure out between the grade book and Schoology what needs to be done to get those graded assignments completed. And every course does it differently in a folder system, and it's very difficult to track an assignment in the grade book to the Schoology system and figure out what needs to be done. It would be easier if it was just, if there was a folder for graded assignments for each subject.
Well, thank you, caller, for that feedback. You know, we will take a look at that. We have made some changes already to our grading policies. And we met actually just today, our instructional services folks met with our SAC, our Student Advisory Council, to get additional ideas about how to work around grading and student workload. We did reduce the number of assignments for this quarter upcoming from 9 to 6. We eliminated, effective this month, zeros for kids that had fallen behind, so they don't get so far behind that they lose interest and will to want to continue. And we're looking at additional ideas. Mr. Smith, did you want to share some others around that?
So I just wanted to say that for that Schoology information, we're in a pilot phase this year for Schoology. We'll be rolling out across the entire system next year. And so while we're in that pilot phase, it's important for you to share that information about folders with your teacher, your child's teacher, and the principal, so that we can share that information back to the overall team and make those updates to the system that will help students be more effective in the classroom.
Thanks, Mr. Smith. And one of the things you said, if your child is struggling, please reach out to the teacher. And after you've reached out to the teacher and you feel that the issue you presented is still an issue, continue to reach out to the school principal. We are here to get every child by name and by need served in the best way they can this school year. I know it has been a tremendous year to try to make that promise happen for every child. We are committed to continuing to do it, and please reach out to the teacher and then reach out to the principal, and we will do everything we can to meet your child's needs as they continue through the school year. Let's take another call. Caller, welcome to the 2021 Town Hall.
Happy New Year.
Happy New Year.
New Year.
Hi, I have a couple questions. So first, is the vaccines going to be a requirement for the teachers, just like, you know, all the vaccines for the kids in order to attend school? And second question, will you prioritize vaccination for the teachers, like maybe K-2 teacher, or especially Brookfield Elementary School, they should get it first? And finally, kind of put you on the spot here, because from the return to school plan, it sounds like vaccinate the teachers doesn't fit in the whole open the school plan. So why should the teacher get the vaccine before the high-risk people? It's kind of like they're going to get it and they still work from home. Just, sorry, a strange question. Thank you.
No, those aren't strange questions at all. Let me try to take a few of those. Let me be clear. And let me be clear with you in our conversations with the Fairfax County Health Department and with ANOVA. Our teachers are being placed, our FCPS staff are being placed in 1B as essential staff, essential to returning to school in person. we will return to school in person this coming school year, the second semester. It is going to happen. We're finalizing when it's going to happen, but it is going to happen in this school year. I know it has been a long wait for many groups. We had 4 of our 8 groups in prior to winter break, and I understand that. I do want you to know at this time we are not requiring the vaccine for our teachers. As you know, nationwide, there are many people, some from personal experiences and some from historical experiences, who have concerns about the vaccination. We're going to do all we can to provide more information about the vaccinations and to have additional chances to interact with the community with a panel of experts who can help navigate how that vaccination decision is made by each person, each employee, but also as the vaccine continues to roll out. We know these are family decisions and individual decisions, but we want to help provide culturally responsive supports for you all, our entire community, as you face the decision to vaccinate your family. We are certainly excited about the news to have our FCPS family, and it is with the intent to return FCPS to in-person instruction. Let's take another phone call. Caller, welcome to the 2021 Town Hall. Hi, caller, welcome.
Hey, how are you?
Good.
As a teacher and coach in Fairfax County, there currently exists a double standard in this county. One is the academic standard, in which strict adherence to the mitigation strategies is the requirement for returning kids to school. And then there's the athletic standard, in which masks don't have to be worn depending on the sport you play. Social distancing is impossible to maintain across all sports, and even hygiene is almost an impossibility as well. How do you justify this double standard? How do you address the very real perceived prioritization of athletics over academics? And why is it okay to flaunt our mitigation strategies in one avenue and not the other?
Thank you, caller, for that question. And by the way, I did want to just for a moment respond to one part of the question the prior caller said. We are working closely to prioritize our FCPS groups. Yes, all of the FCPS staff will have the opportunity to get the vaccination, but we are looking to prioritize those who are working with students now or who will be working with students very soon as we implement our return to school or unpause our return to school plan. I want to take the question around athletics and answer that head on. First of all, we have strict mitigation strategies around our athletic programs and have from the very beginning. In fact, school districts around the Commonwealth have contacted me for the training that we have done with our coaches and with our staffs to ensure that students who actually were conditioning back in June, months and months ago, could continue to not only condition, but we have the entire way followed the guidance of the Virginia High School League. I know for some this seems different, but Virginia is one of the only states in the country that has an independent league that runs high school athletics. We've been working with them closely the entire way, and we have followed their guidance, including the guidance to remain open for our seasons. As you know, the Virginia High School League delayed the season at the beginning of the year and to start it in December. We have done that thus far, and we have had limited transmission in our athletic programs, and we have been sharing the data and will continue to share that data with the school board and with our community. We do want all of our students, not only in our athletic program, but also in our co-curricular programs, band, theater, orchestra. And I hope to have announcements around those co-curricular programs to share with the community very, very soon. So thank you, caller, around that. And we will continue to keep you all updated on our academic, co-curricular, and athletic activities here in Fairfax County Public Schools. Let's take another phone call. Caller, welcome to the 2021 Town Hall.
Thank you.
Thank you.
This is Sandra Davis, and a question that I've been wondering kind of from the beginning of the school year is why the teachers are not teaching from their place of employment, whether they're virtual or not. Because if they're in the classroom and there's no students there, it seems like social distancing wouldn't be a problem. And it would streamline professionalism as far as, you know, the length of time they're teaching and stuff like that, and easier to get a substitute if they can't attend one day. The other thing is that the last several school board meetings, the board members talk a lot about they're getting contacted by terrified parents. And I think they almost all say that, but 50% of us are not terrified. And we had our option eliminated last fall, and that gets to be a frustrating thing to hear over and over about families being terrified, because nobody's trying to force the terrified people's kids back into school. But 50% of us don't have our option acknowledged yet. And I noticed that now that the vaccinations are coming out for the teachers, that there's rumblings about, well, maybe we shouldn't go back till the kids are vaccinated. And there's not even a vaccination for children. So as a parent, it starts to get really frustrating.
Well, thank you, caller. First of all, we hear you. I understand the frustration. I absolutely understand the frustration. And as I said earlier this evening, we will return to school in person this school year. We will return to school in person this school year. We are moving forward. We paused last week, but we are moving forward. I do want to answer the question about teachers in their classrooms. That's something we've looked at, and we are planning, as part of our return to school plan, to give a chance for our teachers to get back in the classrooms before students return to them in person. We do have a lot of our teachers that face real child care issues, and that is one of the reasons that we have allowed them to stay at home virtually, and many that have family members that have had challenges or being health compromised, and we have allowed that opportunity while we were virtual. But we are returning to schools in person, and we will be asking our teachers to return in the classrooms prior to the return of our students in person. You know, Alan, I want to just take a moment to talk a little bit more about as we're coming back in person, the model for teaching is this concurrent model where teachers will be teaching students in front of them, face-to-face in person, but also virtually. Tell me a little bit about, there's obviously challenges to teach all students virtually, but there's challenges to do students both virtually and in person. Take us through some of the challenges and how your school and staff worked through some of those during your pilot and during groups 1 through 4 being back in your schools.
Of course, you know, running a classroom's already challenging. And then when you think about also offering learning online to students at home, there's just so many things that teachers have to keep in their mind. And so I think that one of the things that we recognized early on is the schedule is really important. And so if face-to-face students are coming into the classroom, then you might need to have something else assigned for your online students to do. And then you'd transition and work, you know, you get your classroom settled and then transition to an online activity and interact synchronously with your kids at home.
Thank you. Thank you. You know, that's very helpful. And, you know, one of the things I think is that we're going to continue to provide professional development and supports for teachers as we have them do the concurrent model. And I know, Mr. Smith, one of the areas of responsibility that you have is around our instructional technology department, and we've done a lot to provide additional technology supports to support teachers as they do the concurrent model. Is there anything you'd want to share around that?
Yeah, teachers are using a variety of technology tools in the classroom to support instruction. We have large monitors, we have individual cameras, special speaker systems, and so we really feel that that technology has gone a long way to make the learning environment as inviting as possible for those students at home and for those teachers who might be at home as well.
Fantastic. I know you did a lot, frankly, under your leadership We were able to bring to the board back in the spring the FCPS on for middle school students. They all got new laptops this year. And we worked over the summer to get additional laptops for our elementary school students. And I know we're continuing to work, and I know the board is interested in how we can get additional devices tailored to our youngest learners, pre-K2. One of the things I think that's also important to know around technology that you did and your team did was create that parent support line. So if there are technology questions, they can still reach out in the morning through late at night and get the help they need around technology. So I want to thank you publicly for the work you've done around that and your team has done. And I really do appreciate it. So thank you so much.
Thank you. And the team is just phenomenal. The ideas, the creativity, the parent support line is still active. We get many calls every day with questions from parents on how we can better support students. We have a committee already stood up to look at those devices for our primary students to identify what that best device is. It's parents, teachers, administrators are all part of that committee so that we can make the best recommendation to the board.
Fantastic. Well, we have a few minutes left. Let's take a few more calls. Caller, welcome to the 2021 FCPS Town Hall.
Thank you so much for having me on. This is Randy Cosentino. Just want to start by saying I'm excited and relieved to hear that kids will be returning to school this academic year. And then you mentioned earlier to a caller that in considering timing, you're taking into account the perspectives of stakeholders when considering when to reopen. And then another caller alluded to the fact that about 50% of parents were desiring to return much earlier this year. When's the last time the district assessed the sentiment of the population and community about return to school? Have you evaluated how perhaps that's changed throughout the school year and where it stands now? And then secondarily, how are you assessing the impact of the sustained online learning on our kids' emotional and mental health? Because I know a lot of them are really struggling.
Well, thank you, caller, for that question. We did do an assessment in the fall as we were finalizing our return to school plan. And we are allowing schools to work with families now who do express a choice either to return virtually or to return to in-person instruction. So we are doing that school by school so that there are opportunities for that choice to continue to be utilized. I certainly recognize the challenges that you talked about, and one of the things that we want to continue to do is listen to our community and do everything we can to support our parents in whatever decision they make. As we continue to return more of our students to in-person instruction, we will do everything we can to accommodate those parents who want to have their children join if they were virtually, or some parents who, after looking at where we are now with where we are in the community with COVID, or where we are with the vaccination process, to make a different choice. And we know that many of our families did opt for the full virtual option back this summer for the entire school year. So thank you very much, and we'll continue to have. Mr. Smith, did you want to add something else to that?
I just wanted to add that we have a multi-phase study that's going on of our distance learning efforts, where we're reaching out to families, we're reaching out to students and staff, and mental health and well-being is one of those areas that we're focused on, and we're using that information to share back with principals, counselors, and other support staff to provide resources and supports for students based on how well they're faring during distance learning.
And we do know we need to be honest with ourselves that some of our students really are struggling. We were one of the first school districts in the country to put out the academic data after first quarter that showed that some of our students, particularly those who had struggled under pre-pandemic conditions, were struggling even more in this pandemic. And we have an equity obligation to put equity at the center of all that we say and do, and we must meet the needs of those students. We are looking at the stimulus, the second stimulus that was just passed by Congress, and we are looking for information. We hope to find information as soon as this week from the state around additional resources that we'll be able to put in, including resources focused on extended learning opportunities for students, so that we can directly address learning loss that we already see occurring, and that we can directly intervene now in this second semester, now as we look at the summer, to intervene now to deal with those targeted students that we know are not having success academically, or who are going to need additional social emotional supports as we return in person than what they have had before. Let's take another call. Caller, welcome to the 2021 Town Hall.
Hi, thank you. First, I wanted to say I really appreciate the amount of effort you and your staff are doing in trying to get it right and just caring for the kids.
Thank you.
Followed up with a two-part question. Who has the final authority to stamp the back-to-school plan? I've listened into a couple of the working sessions, and it feels like the school board kind of picks the flaws out. But when does someone say, this is it, this is the best we have for today, we have to move forward? And part two, what kind of data or metrics do you guys have, or can you start including or share about the kids that are missing classes or absences compared to last year? You know, we keep talking health and equality, but it would help us to hear the other side of the coin of who's being left behind in this current setup. You know, I know we also hear about the drop in school-reported abuse and whatnot, so I think that's another metric that would be very valuable. Thank you.
Well, thank you. Let me take that last one. We have shared a lot of our academic metrics, and we can certainly take your feedback back about how we're looking with attendance and other ways to try to measure student engagement. So that, and I think your point is that our school board and our community have the full picture of our student health, whether it's academic or social emotional. I do want you to know that ultimately I report to the school board, and I have operational day-to-day control of the school system, but under the ultimate direction of the board. When I made a recommendation to go virtual in July, the school board asked me in that very same meeting to bring a plan to return students in person and to bring the necessary metrics around that plan. I've tried to do that every month, and I've sent that information in as FYI and continue to have these informational updates. Ultimately, the board will or could direct me to go in a different way than the plan I presented, but I think we're all on the same page that we want our students back, we want them back in person, and we want it to be in a safe and responsible way for our students and staff. And I know we will come to that fruition of students in person here in 2021. We are working together, we are trying together, and we will accomplish returning students to in-person instruction together in this school year. I want to thank everyone for joining me this evening at the beginning of the 2021 year. As I said at the beginning, hope and help are on the way. Mr. Smith, thank you again for being here as our Chief Operating Officer, and Ms. Mukai as principal of one of our wonderful elementary schools. The FCPS family stands united and stands with you to continue to do everything we can to support our students, our staff, and our community. We will be with you again very, very soon. This new year's off to a great start, and we hope you will continue to work with us to have a wonderful rest of this unprecedented a school year unlike any other, the rest of the school year. Thank you for joining us, and we'll see you again real soon.